To run a patient test, you first will need to log in by either typing in your username manually or by utilizing a barcode scanner and scanning your badge. Once your username has been inputted, press continue. And then at the bottom of this screen, you will be able to enter patient. This screen will ask you to input in the patient ID. The patient ID can be found on your test tube. You will need to manually enter in your patient ID, and then you will need to reconfirm. You then can hit Start New Test. It will ask you to connect the analyzer. You will want to look for a blue pulsing flashing light on top of the analyzer. If you see that, hit Next. The analyzer will connect. And then it will prompt you to enter in a cassette. Today we're going to run an FFN test, so I will take my FFN cassette and I will insert it into the analyzer until I hear a click. The analyzer will recognize the cassette has been inserted and will ask you to wait. It will ask you to confirm the type of test that you want to run. Since I've entered an FFN cassette, it will ask me if I want to run an FFN test. To confirm, please press yes. It will then ask you to prep your sample. You want to ensure that your sample is at room temperature, and you will want to mix it together by rolling between your palms. You then will want to remove the cap and set that aside. You'll need to wait for the analyzer to prompt you to hit Next. Once that appears, hit Next. It will then ask you to add your sample. You'll want to take your pipette and insert on a tip. You then will insert your pipette tip into the vial with the plunger depressed, and then you will release the plunger and pull the pipette out, collecting a sample. You then will dispense the sample into the cassette well, and you'll want to dispose of your pipette tip into a biohazardous waste bag. You will also want to ensure that you recap your sample. You will want to wait for the analyzer to recognize that a sample has been added. This might take a few moments. Once the sample is recognized, it will give you a countdown until your sample result is ready. You will need to wait until a result is displayed. Once the analyzer is done reading the cassette, it will ask you to remove the cassette and dispose in a biohazardous waste bag. Then your result will be displayed on the screen. You will have a couple of options. You can either view the patient's history, or you can print out the result. To print out the result, press Print. A label will be printed out, which you can maintain for your records. You then can log out.